Hey, podcast family. I hope you're having a great last week of July, wherever you are. This episode was inspired by the journey that I've been on to address my tongue and lip ties and a lot of the pushback that I've gotten since sharing my story from people who work in the dentistry world, saying that tongue and lip ties or oral restrictions either don't exist or they don't cause as many problems as I'm claiming. Well, I figured I'd bring in the experts to talk about this because there are definitely a lot of problems associated with them. That is for sure. I am a living example of that. So my guest today is Sara Mercier. She's been a dental hygienist for almost a decade, and when she was introduced to myofunctional therapy and airway medicine, it changed her whole outlook on dentistry and what she could do to contribute to the field. As a myofunctional orthodontic patient herself from the age of 10, Sara has a passion for working with adults who have slipped through the cracks of traditional medicine and dentistry, going decades without answers or solutions to the root causes of their health concerns. Hello, that's me. She has a particular passion for exploring how myofunctional disorders affect sleep, hormones, and autoimmune diseases, such as polycystic ovary syndrome. Sara provides exclusively virtual myofunctional therapy and works with myofunctional therapy clients around the world. She was granted the credentials Certified Myofunctional Airway Specialist in 2021. I really hope this episode is helpful for you if you feel like you may have tongue, lip, or cheek ties or airway restrictions as an adult and feel like you have symptoms that have not been able to be addressed with other interventions. If you want to reach out to me with feedback, definitely hit me up on Instagram, and I look forward to hearing what you think of this episode. Hi, Sara. Thank you so much for being here with me today.
Hi, Nicole. Thank you so much for having me. I'm so excited to talk to you today.
Truly, same here. I was saying to you before we started recording that I truly feel like I've stumbled upon an entire subculture of dental and oral health that the majority of people are not aware of due to this tongue tie situation. And, I truly had no idea that I was getting myself into or what I was getting myself into when I saw my dentist earlier this year to discuss addressing my tongue tie. I mean, I didn't even know that I had multiple ties or that that could really even exist. And then when I did do the surgery, I got so many people accusing me of spreading misinformation about all this stuff. And that was really surprising to me because as we were talking about, many of them were people who have been in, the dental industry for decades. So I know we're going to get into all of this. And I figure what would be so helpful to start with is kind of your story about how you got into this, because I feel like we all sort of stumbled into this to some degree.
You're exactly right. You're exactly right. It's kind of like a rabbit hole where you start learning and the puzzle pieces start falling into place, and all of a sudden the light bulb comes on. I call it like the light bulb moment. And I had a light bulb moment myself. So my background is in dentistry. I'm a dental hygienist. Been practicing for almost 9 years now. And so the one thing I have to say about the misinformation, or I wouldn't even say misinformation, I'd say there's a little bit of uneducation and ignorance around tethered oral tissues, tongue ties, myofunctional therapy. And it's just because I think the big factor is that this is not taught in general curriculum in dental school, dental hygiene school, med school yet. I put the caveat yet because we're just now starting to address airway health. So dental hygienists, dentists, dental therapists, we're all trying to look at the teeth, the oral health, the periodontium, the gum tissue, look for oral cancer, screen for all of those things. And we even look for signs of like HPV that can show up in the throat and cause oral cancer, things like that. So we are trained to look at the oral cavity, but we don't put two and two together with sleep or with tethered oral tissues. And I'd say in dental hygiene school and dental school, we're taught that somebody can have a tongue tie, which is called ankylosing, is the medical term for a tongue tie. And a patient can have ankylosing. And we ask the patient, is there a problem? Does this cause speech issues? They say no. And we say, does it bother you? They say no. We say, okay, it's fine. And now with airway dentistry, we realize, oh no, it is not fine. So I think it's just a little bit of lack of education, and it's not at the forefront yet.
No, definitely not. And so for you, what happened? What was the backstory behind you getting into becoming an expert in this area?
Becoming a myofunctional therapist was kind of a full circle moment for me. I have a posterior tongue tie, which is harder to diagnose than an anterior tongue tie. Anterior is towards the tip of the tongue. Posterior is towards the back of the tongue. Again, we're taught in dentistry hygiene school, look for a tongue that's completely stuck to the floor of the mouth. And that is not always the case with tongue ties. So as a child, I had an open bite, a tongue thrust, and my orthodontist was very forward thinking. This was like 1998. And so this was back in the late 90s. He recommended that I see a myofunctional therapist. Back in the 90s, and even today, sometimes a myofunctional therapist, orofacial myofunctional therapist, is sometimes called a tongue thrust therapist, because a tongue thrust is a common symptom, a common myofunctional disorder if you do have tethered oral tissues, things like that. So in order for anybody in braces should be doing myofunctional therapy, because teeth only move two ways. When force is applied, usually that's with braces, we apply physical force, or when physical force is applied unnaturally by muscles that are not working correctly. So my dentist or my orthodontist said, hey, Sarah, they told my mom, you need to go myofunctional therapy to fix your tongue thrust. However, nobody caught my posterior tongue tie. So I've gone on my whole life having issues with just being tired all the time, anxiety, depression, and some of it I know is hormonal, some of it is genetic, but I just always felt like, why am I always waking up tired? And so coming full circle, I realized I just took a continuing education course about sleep dentistry for my dental hygiene license. So in medicine, we have to take, continuing education to renew our licenses, keep up on the updated, newest information to help our patients. I fell into a class and all of a sudden it was like the clouds cleared, the sunlight came down. I saw, it was literally like an epiphany. And I said, oh my gosh, I have a posterior tongue tie. This is causing my sleep disordered breathing. This is why I'm not sleeping well. And so I am very passionate about helping, especially adults who have gone their whole lives without addressing this, like yourself, because we go through all of the childhood development and we have these problems and we don't know that it's causing so many issues in adulthood. So now I help people just like me who have, like I said, I had these problems since I was a child.
Wow. Okay. This is so incredible. And there's one question I wanted to ask before we moved on, because I feel like we hear this all the time, this tongue thrust thing. What does that look like? Like, what is someone looking for if they have a tongue thrust?
So a common sign of a tongue thrust, and again, this is for a professional to diagnose, such as a speech language pathologist or like an occupational therapist, but generally it's speech language pathologist. But a tongue thrust is what we call an immature swallow. So an immature swallow is how an infant feeds either from a bottle, from the breast. The back of the tongue, it's like a wave motion, a wave pattern. So the back of the tongue comes forward and then does a scoop motion to collect solids, liquids. And then infants, as we start introducing solid foods, that tongue swallowing pattern needs to change from tip to back in like a sweeping motion. So when you have a tongue thrust, you're thrusting that tongue forward and your tongue is hitting your teeth. We can have an anterior thrust where it's hitting your front teeth, or you can even have a lateral tongue thrust where it's kind of squishing out the sides of the teeth, if that makes sense.
Yeah.
Or you can have both. So for a tongue thrust, if you swallow, your tongue hits your front teeth, chances are you have a tongue thrust. Sometimes it's because you don't have enough room in your mouth. Sometimes it's because of a tongue tie, and sometimes it's both. For me, it's both. And that posterior tongue tie, when you have a tongue tie, it's like a rubber band. It's like a tight rubber band pulling down on the back of the tongue, and it physically cannot reach that wave motion that it's supposed to be reaching. So that's what a tongue thrust is. And it usually moves teeth as well. And so if you have orthodontia, you have orthodontics, your teeth shift after, especially those front teeth, you should be evaluated and have that checked out.
Oh my goodness. Okay. I know multiple people who've had orthodontics or braces and their teeth shift back within a couple of years. So,
and the question is why? The question is what force is being applied, right?
That's not what people are asking though, which I find fascinating, right? Because you and I are clearly the same. We're asking the why. I've always been asking the why. I'm like, why are your hormones all messed up? Like you have to have a reason. So yeah.
What's the root cause?
Right. Exactly. Yeah. Okay. So that's really helpful. I also have posterior tongue ties. I kind of discovered that after having the anterior one addressed. So now they're showing up or it's showing. So I get to go back and have a revision, which is going to be so fun.
Yeah.
Anyway.
And that's something to note is anytime you have an anterior tongue tie, there's
Yes.
always a posterior component. So you
Right.
can have a posterior tongue tie that's not to the tip, but anytime you have an anterior portion of a tongue tie, there's always a back part as well. And that's why
Right.
myofunctional therapy is critical. If somebody doing a tongue tie release is properly trained, they will not release that tongue tie until the myofunctional therapist has given the green light. Because if we don't tone the tongue first and train the tongue where it should be, you're not going to get the best results. So that's also important when you're looking for a provider is, the big questions I say to ask is, do you work with a myofunctional therapist or do you, refer to myofunctional therapists? And at what point do you do a tongue tie release? And so if they say, oh, what you can do it same day, red flag, go somewhere else.
Yes, I know. I've had some interesting red flags, which we'll get into. But yeah, okay. So that's all really helpful. And then can we talk a little bit about other myofunctional disorders? I know you mentioned the tongue thrust and a few other things that you were experiencing. Are there other things people should be paying attention to?
Absolutely. So, well, the definition of an orofacial myofunctional disorder is abnormal development of oral and facial musculature and bone structures. And it's due to abnormal resting tongue and lip posture, abnormal chewing and swallowing patterns, and blocked airways, possible speech problems. Not everybody with a myofunctional disorder has a speech problem. And usually it's because we come up with compensations, which we can talk about. You can have something that's common, but not normal. For example, snoring. Snoring is common. It's never normal. Having a tongue tie is common. It is not normal. It is not biologically what should be happening. So you can have somebody, the myofunctional disorders can look like lips that don't close, mouth breathing. Your chin overactivates when you keep your lips closed because your lips don't have the strength, because that's a myofunctional disorder. Also, bruxism, grinding, clenching and grinding of the teeth is due to usually an airway obstruction because that tongue tie is pulling the tongue into the airway, or the tongue is just not strong enough to rest where it should be. So I think maybe backing up a little bit, I can explain what proper oral rest posture is. So proper oral rest posture is the tip of the tongue is on the spot behind the two front teeth. When you say the spot, if you say the letter N and your tongue ends, if you don't have any speech problems, it's right behind the two front teeth on the alveolar ridge, on the ridge of teeth, on the ridge of the gums behind the teeth there. Then your tongue should be lightly suctioned to the palate all the way from the tip to the very back of the tongue, and your lips should be closed at rest, breathing through your nose 24/7. So if you do not have that proper oral rest posture, you have improper oral rest posture, and that is a myofunctional disorder. So we need to address, why do you have this improper oral rest posture?
I just want to take a moment and say to anyone who's listening, just try and do what you just described there with your tongue and all that. None of this had ever occurred to me before working with a myofunctional therapist. I was like, wait, what is my tongue supposed to be doing? So it's incredible because I'm imagining that there are going to be a lot of people who try to do what you just described and it doesn't come naturally to them.
Especially exactly what you just said, if it doesn't come naturally, if you take inventory, if you do a body scan and you say, where is my tongue at? And it doesn't naturally, habitually, subconsciously go to that spot, there's a problem. It should be completely subconscious. You shouldn't have to think about it. That's just where your resting posture should be. So if you have to think about it and really try to achieve it, there's a problem. And sometimes if you have like a posterior tongue tie, you physically cannot achieve that until we address that problem.
Right. Yes, exactly. Okay. So I think we should talk about myofunctional therapy. So this is obviously the work that you do. And like I said, before I had seen this dentist, I didn't know what a myofunctional therapist was. I was very confused by all of it. And I get that feedback from a lot of people who I've been sharing this about online, that they just don't know where to start. And they're like, do I go to a dentist first? Do I go to a myofunctional therapist? What is a myofunctional therapist? So can you maybe talk just a little bit about how someone might even start this process of figuring out how to diagnose this problem?
Absolutely. Well, number one, if they're listening to this podcast, hallelujah. This is like, probably you're like, oh my gosh, this sounds like me. But what I do as a myofunctional therapist, I like to say I'm a personal trainer for your mouth. It sounds silly, but that's exactly what I am. We work on strengthening the tongue, the lip muscles, using the correct muscles to do the correct job. So we talked about compensations just a minute ago. I like to liken myofunctional disorders to explaining, could you walk backwards your entire life? Of course you can walk backwards your entire life. Your body is smart. It will figure out a way to get a job done. Are you going to blow out your knees eventually by the time you're in your 50s, 60s? Absolutely. You are asking your body to do a job that it is not designed to do. So that's where we see a lot of patients have TMJ problems as they get older, is because they're using their mastication, their chewing muscles, their buccinators, their masseters, they're using these muscles that are meant for chewing to keep their mouth closed. So you're overactivating muscles that are not supposed to be used. A lot of people use Band-Aids, temporary Band-Aids, such as Botox injections to relax those muscles. Again, we're not addressing why those muscles are tensed. And a lot of times we're taught, oh, it's stress. That is, we've done studies and we find out, well, of course, also poor sleep will cause stress, but the stress is not what is causing those muscles to overactivate and strain. So myofunctional therapist, like I said, basically a personal trainer, we train the muscles to do their job correctly, and we undo those bad subconscious habits that people have had, usually since infancy. Whatever job your body's been doing incorrectly, we unlearn those bad habits. So that's what myofunctional therapists do. And like you said, starting, where should somebody start? I always recommend, if you find an airway dentist, great. It's like finding a needle in the haystack.
Yeah, girl.
And finding an airway dentist and airway ENT is really important. And that's what I do for my clients. So part of my service as a myofunctional therapist, part of my myofunctional program is me helping that person find a team and assemble a team as close to them as possible, so that we get all of the people on the same page and we get that person what they need. My biggest problem and my biggest beef with the medical professions is that nobody talks to each other. And it's a problem, because you have your dentist, you have your cardiologist, you have your endocrinologist, you have just your primary care doctor, you have your osteopath. We're all treating the same person. We're all working on the same body, but nobody talks to each other. And my favorite, I love to say, when I'm practicing dental hygiene, I'm cleaning your teeth and I'm, addressing your oral health. I don't detach your head from your body. I clean your teeth, and your teeth are attached to your body. And when you think about it, it sounds silly, but it's like, a duh, like obviously. So, all of these providers should be talking to each other so that the patient gets the best outcomes. So part of what I do is help people find airway providers near them. There's different websites you can search, like the American Academy of Physiological Medicine and Dentistry, the aapmd.org. But really, I would say, myofunctional therapists, we start with your oral rest posture, but I help people find the right providers near them, because like I said, finding the right provider, because this is so niche, is almost impossible, but I work with people all over the country. So I kind of have a network set up.
That is so awesome. And it's so helpful. I can't tell you, my Virgo brain is so happy to have this conversation and talk through the step-by-step process of what one should be looking for and what they should do. Cause like I said, I was just feeling around in the dark. So thank you for that.
Absolutely. A good screening question, like you mentioned, is, if you want to just call some dentists in your area and, just screen them, questions to ask are, do you screen for airway health, sleep disordered breathing? Do you work with a myofunctional therapist? If they say no to any of those things, they're probably not who you're looking for. That's just kind of an easy litmus test for those people.
So good. So helpful. Okay, so I obviously host the period party. So we're going to talk about hormones and how our mouth and our oral health affect our hormones. So can we talk a little bit about myofunctional disorders and hormone balance or hormone disruption? How are these connected?
Absolutely. Great question. Two ways, or I would say two main ways. One is sleep. The other is proper oral rest posture turns on the rest and digest system in your body, your parasympathetic nervous system. So if your tongue is not where it should be, you're in constant fight or flight mode. And we know what that does to cortisol levels, and other hormones get completely thrown out of whack. So let's go back to sleep. Myofunctional disorders, how are they going to affect sleep? It all comes back to where your tongue rests. So what happens is if your tongue is not in the correct spot during the day and it can't physically reach that position during the day, there's no way that it's happening at night. So a lot of the time you lay down to go to sleep, your muscles will relax because you're laying down, gravity goes to work as well, plus the body relaxes as it's ready to go into sleep. A lot of times the tongue will collapse and fall into the airway, into the trachea, and then all night long that lower jaw juts forward, trying to open the airway. It's like CPR, lift the chin. Your body is doing CPR on itself. Okay. So your chin, you lift your chin, your jaw just juts forward. And so every few minutes, every few seconds, your body can get out of that deep sleep in order to breathe. You're essentially choking in your sleep. Sounds dramatic, but that's really what's happening. And we figure that out by doing sleep studies. Now, the biggest thing, again, this is where, Nicole, we talked about finding the right providers. I did 2 in-lab sleep studies. I had 2 sleep physicians tell me I was fine. All of my sleep problems were in my head because I only stopped breathing 4 times an hour, not 5. And I said, well, just thinking about that, if I stopped breathing 4 times an hour during the day, people would say, Sara, what is happening? What is wrong here? But suddenly at night, that's okay. I'm like, that doesn't sound kosher. That doesn't sound right. So I ended up finding the best of the best, Dr. Zaghi at the Breathe Institute. He's an airway, ENT, and sleep physician. And he looked at my sleep study and he said, Sara, you stop breathing 4 times an hour for 10 seconds or more, but you stop breathing every couple of seconds. So every time you're falling asleep into like deep REM sleep, I don't enter REM sleep. And so the only way to check that is through a sleep study, which is why it's important to collect that data when we're working with your airway team, your myofunctional therapist, your airway dentist, your ENT. I don't enter REM sleep. My blood oxygen drops from 98% to 86% when I'm sleeping. If I was in the hospital, I would need to be on oxygen. So all night long, my brain cells are dying. If I don't address this, I'm 30, almost 31. I'm gonna have Alzheimer's. Like this is cardiac problems, Alzheimer's. And so the sleep is thrown off, don't get REM sleep. I don't get enough oxygen. And so all night long, I'm in fight or flight mode. So, we've talked about before cortisol levels. That fight or flight mode will release different chemicals in your body to stimulate the body to get out of a dangerous situation. So I'm a sister. I have PCOS, polycystic ovary syndrome, and the hormone balances with cortisol are huge in PCOS. So if I have this fight or flight going on 24/7, my cortisol levels are constantly raised. My other hormones are not regulated. And so this causes such an imbalance. Another important factor, like we said, we've talked about sleep, and we're talking about where the tongue rests in the mouth. The tongue resting in the mouth properly in a proper swallowing pattern turns on the vagus nerve. The vagus nerve is your rest and digest nerve. So you have a complex of muscles and nerves in your pharyngeal area where your throat is. If that tongue, the back of the tongue, is not resting on the palate, you're not turning on that rest and digest system, and you're not going to get correct peristalsis, which is the movement of liquids and solids through the body. You're in this constant fight or flight. What does this do to your cortisol levels? Through the roof. What does this do to your blood pressure? Raises blood pressure, poor sleep. So it's a combination of all of these factors. But really, I think the biggest one is cortisol. And then we just have chronic inflammation when we deal with, the sleep problems, sleep deprivation. Chronic inflammation causes other hormone disruptors.
Okay, this is, to me, something that I think is so fascinating because we're not at all having the conversation about how oral restrictions or ties are like an internal stressor that are triggering your HPA axis to go into overdrive. Because I think back to my childhood, and I remember when I first started with my myofunctional therapist, she was just like, oh, did you bite your nails? And I was like, well, I've still really struggled with it. And she was like, well, did you have a pacifier? And I said, yeah, until I was 2. And then suddenly I started biting my nails at 2 and no one could figure it out. And she was like, well, pacifier out, nails in, nail biting in. Mm-hmm. And my osteopath has also talked about kids that he's seen as well with, chronic nail biting or like biting along the edges of your fingers or things like that. And then I had terrible gut health as a child. And, you know, and my diet was fine. Like we didn't eat a lot of sugar or soda or any of those things. Like there really wasn't a lot of processed food at all. So there wasn't really much of a reason why. And I remember doing testing and things like that, and nothing ever came back, unsurprisingly. And so connecting these dots was incredible to me. And so I'm curious, or do you see those kinds of things in kids and then they just get progressively worse over time?
Exactly.
Yeah.
I think, like we said, these habits form from early infancy. The body figures out a way to make things work. So the
Right.
thumb in the mouth, the pacifier in the mouth is a form of self-soothing. So the tongue is supposed to be, think of your tongue as your body's pacifier. If your tongue is resting on the palate where it should be, tip to back of the tongue, that's your rest and digest mode. So if the tongue is low, we'll call low resting tongue posture, it's not on the roof of the mouth, your body is in this fight or flight. You'll have thumb in the mouth, you'll have chewing on the nails, you'll have biting on pens, you'll have oral fixations. Okay. So yes, exactly like you said, biting the nails. And so kids, I have adult clients who are actually still thumb suckers, and they're, you know, embarrassed to say it, but because they're an adult, but it's that self-soothing mechanism. And it also, that thumb sucking opens the airway, it pulls the lower jaw forward. So not only is it self-soothing, but it's also opening the airway and helping for the breath. The body is so, our bodies are actually incredible. Like when you think about it, incredible machines where they're like, hey, this isn't working, I'm going to figure out a different way to make it work. Unfortunately, there's side effects to those things. So, you know, when you say like, do these myofunctional disorders cause other problems? Absolutely. With, you know, the thumb sucking, the nail biting and things like that, it just gets worse into adulthood. As far as if we don't undo these habits, they don't just fix themselves.
Oh my God, I could not agree with you more. I remember my grandmother offering me $10 a nail for every nail that I stopped biting for my 10th
Yep.
birthday. Yeah. So I was like, $100, sign me up.
Yeah.
Yeah, I know. And of course that did not work at all.
And the thing with the gut health, that's a great point that you brought up with the gut health, is when you have poor oral rest posture, we just talked about the peristalsis, you're not
Right.
turning on your rest and digest system. So if
Right.
you're not turning on the rest and digest system, you're not going to be digesting food properly. A lot of people with myofunctional disorders don't chew enough because their tongue isn't strong enough. So they're swallowing bigger pieces of food than should be swallowed, which is harder to digest. When you swallow, you have an improper swallow pattern. You usually ingest more air when you swallow, can cause bloating and dysregulation. Myofunctional disorders causes mouth breathing a lot of the time. If we have sinus blockage, we have mouth breathing, low tongue posture, that mouth will drop open to allow air in. When we have air and we have open mouth posture and dry mouth, bacteria go nuts. Bacteria love a dry mouth. That's why you'll see a lot of cavities happen, a lot of periodontal problems when you have dry mouth. Well, when you swallow, where do you think that bacteria goes? Travels down the digestive system into the gut. So if you have a dysregulated oral microbiome, you're going to have a dysregulated gut microbiome as well.
Yeah, I mean, this is so crazy because it opens up a whole world for people who have been told they have dry mouth, or just breathing through your mouth is no big deal, or any of these things, or chronic constipation. Because I was chronically constipated as a child, and then it just got progressively worse as a teenager into adulthood until I dealt with a lot of the dietary gut related things. But it's still something that's persisted. And I'm like, I don't know what else to do. So it's really interesting.
You know, what's interesting that you just brought that up is your tongue is connected to your pelvic floor. And
yes,
you wouldn't
let's
think
talk about that.
Yes. So the tongue, again, our body is connected. Our body is connected. Our muscles are connected through a system called fascia. It's basically like webbing that holds the muscles in place and holds organs in place where they should be. Think of it as kind of like a little suspension, like a little trampoline kind of, that encases, you know, different muscle groups. So we have what's called the deep frontline fascia that runs from the tongue. And that, remember we talked about that rubber band underneath the tongue. Everybody generally has a frenum, which is that skin underneath the tongue. If it's too short, too tight, or if it impedes function, that's when we classify it as a tongue tie. Usually it's all three things. And if you're using compensations, that's also a tie. So if you're kinked up at the top of your body, up at the jaw, up at the tongue, That restriction runs all the way down the center of your body. It encases your diaphragm, your lungs, your pelvic floor. It branches into 2 branches, goes down through both knees all the way to your big toe. So you say, like, how can my tongue affect the rest of my body? You can literally be pulled out of alignment simply by a tongue tie underneath your tongue. That's part number 1. Part number 2 is also your jaw. So for example, my jaw is rotated up to the left and forward to the left. My shoulder then follows. My left shoulder is elevated. My left hip is elevated, which is going to throw off my muscles, throw off my pelvic floor. So it's muscular and skeletal. So this is why when I just talked about how passionate I am about everybody talking to each other, I want to tell the chiropractor, the physical therapist. I love working with pelvic floor physical therapists because I'm like, if we've got pelvic floor dysfunction, we need to address the other dysfunction, or they're just going to be yanked out of alignment again.
Okay. It's again, totally mind blowing for me because of course I've had all the issues, right? Like the one shoulder higher than the other shoulder, and then the hip, and then the knee, and all the things, and the chronic pelvic floor problems. And I've seen like every single type of practitioner you can ever imagine over the last 25 years. I'm pretty sure I've spent about 50 grand. I mean, if I added it all up, I could cry. And This is right. It's ridiculous, as you know. And so it's like putting all these pieces together, like I said. And so after I had the surgery, I actually, I was spotting. My period had ended like 5 or 6 days before, and I spotted for 3 or 4 days post-surgery. So I was so curious about that.
Just from my knowledge, of course, I'm not a doctor, so I can't diagnose anything, but I would be interested to know, did your pelvic floor loosen up? Did you have a pelvic tilt? Did you have a pelvic tilt that suddenly loosened up? And so, it moves things around. And now, if you have a pelvic tilt, you can have a tilted uterus as well. And so you can have organ tilting if your pelvis is out of alignment. Well, I tell people, if it's a house on foundation, if the roof is crooked, the whole building structure is going to be crooked. Or if the foundation is crooked, the top part is going to be crooked. It's kind of like what came first, the chicken or the egg. But like you said, we release that rubber band up top. All of that deep fascial, strain, you released at least some of it. So I'd be interested to see what, we wouldn't know unless we did an MRI or something looking at your uterus, but I wonder what before and after, what did it look like?
Oh, I wish I could have done that. That would have been amazing. I definitely, though, I noticed a musculature release for sure. There was no doubt. It felt that way. And then of course I was spotting. So I was like, okay, something happened. And the other thing too, that I think is really important to talk about is sort of the mental health component, because obviously chronic overactivation of the HPA axis does all kinds of things to our mental, emotional health. And obviously there's the hormonal component as well. But if we're really looking at the root cause, like what is that, right? Because I talk about this a lot. Your hormones really aren't the problem. They're just responding to a problem, and you've got to find the problem that they're responding to. And so in my case, I'm pretty sure there's a lot of this because I've definitely dealt with sort of like an overactivation of my nervous system for my whole life. And was never, oh, really? Oh my gosh.
Just like you. Yeah.
Okay. So like, what were your symptoms of that? Because mine for me were just like feeling like just on edge a lot of the time, and not so anxious, but just like overwhelmed, and also like quick to anger. Like for me, it definitely felt like a lot of anger issues, I guess, for lack of a better term. Yeah.
That's funny that you asked that. I have a client of mine. She is a clinical psychologist. She works with a lot of teenagers. And now that she's been doing myofunctional therapy and she's done sleep studies and realized that her tongue tie and her orofacial development, affected her sleep, she's having her teens, she's telling the parents, you need to take them for a sleep study because if they have ADHD, anxiety, depression. She has a girl that just did her sleep study, found out her tonsils are enlarged. She got a tonsillectomy. She's now sleeping better. She just got off of all of her anxiety medication. So it comes back to and that's not true for everybody. Again, I have a genetic component in my family where we have anxiety, depression. So for me, it's how much, I always tell my clients, is it 100% your orofacial myofunctional problems? Probably not. I mean, there are other factors, but if the main factor here, if you're choking in your sleep, you're going to have anxiety, and sleep deprivation causes short temper. So I'm right there with you. So you're sleep deprived. What happens when you're sleep deprived and you don't get good sleep? Short temper, easily overwhelmed, poor short-term memory, all of these things. There's about a 90% overlap with ADHD or ADD symptoms and sleep deprivation. So before any clinical diagnosis of ADHD or ADD is made, a sleep study should be done, and an evaluation by a myofunctional therapist and an airway dentist or ENT should be done, because we need to rule out. I'm not saying everybody with ADHD is really just, it's a sleep problem, but it could be. So we need to rule that out. And so, like you said, the anxiety, I've had anxiety my entire life. And, you know, my mom was always like, hey, it runs in the family. It's normal. Again, it's common. It's not normal. Yeah, exactly. And it's common. It's not normal. So my whole life dealt with anxiety, things like that. And once I started, I do mouth tape right now. I'm actually getting a tonsillectomy in September because my tonsils are choking me. They're not leaving enough room in my airway, so I'm choking all night. Well, like we said, you're in fight or flight mode constantly. That's going to put you on edge, right? Like you're in fight or flight mode. You're getting ready to run or to fight. So you're going to be on edge. It's almost like, I don't know about for you, but for me, it's like I'm constantly in this high vibration mode of, like you said, like just quick to react to different things. And it's kind of overwhelming, I would say, where it's hard to concentrate on different things. I'm always looking at different things. But I mean, you know, when we look at sleep is a huge factor, but there's also the hormonal component of you said the polyvagal theory. If your tongue is not activating that vagus nerve to calm down and you have low vagal tone, then you're going to have these dysregulation. It's dysregulation is what it is.
Yeah, of course. It certainly is. Is there anything that you want to share with the people who are listening to this episode, just in terms of like anything else that you think that people should know? Because I feel like you've dropped some major truth bombs, so many gems. I'm sure it's going to open the eyes of so many people who had no idea that this could potentially be an issue.
I would say, as a dental professional, you know, I would say don't necessarily be mad at your dentist or your doctor saying, why didn't anybody tell me this? Because we are learning as well. And so, like I said, this is all very new information. It actually really isn't new, but it's just now getting traction. And so this is not taught in, you know, general curriculum yet. However, the American Dental Association released a statement in 2018 that all dental providers should be screening for airway disorders, sleep disordered breathing related to the oral cavity. Pretty soon, not screening for these problems is going to become malpractice. It's going to become the standard of care. So I would say, if you're like, why hasn't anybody told me this? This is, you know, this is way too woo-woo. It's not, there's no scientific evidence behind it. There absolutely is. And now the major associations are starting to recognize, hey, dental professionals, we have a role to play. We're in the mouth all day long. We need to be looking for these signs of sleep disordered breathing and myofunctional disorders, such as scalloping of the tongue, the ridges on the side of the tongue thrusting, bruxism, clenching, grinding. So I would say, as you know, as a person who you think you might be suffering from those things, ask yourself and look in the mirror, do kind of a self-screen, like, hey, do I have any of these things? Like, do I have sleep problems? Does my tongue hit my teeth when I swallow? Does it feel like my tongue is too big for my mouth? You know, do I feel like my jaw is always tired? I have TMJ problems. If you have those problems, seek out a myofunctional therapist, and I'm happy to help anybody answer any questions that they have, but ask a myofunctional therapist and get linked up with an airway dentist and an airway ENT. Form follows function. Function follows form, right? So how you're functioning is how your face is going to develop. And if you have, say, you know, enlarged tonsils and you can't breathe, you're going to have problems until we address those things. So I would say do a self-screen and then link up with a myofunctional therapist and an airway provider.
Thank you. Thank you. Truly, this information is so life-changing. And I just think that for so long, so many of us have just been sort of like putting Band-Aids on different parts of our bodies. I certainly was that for so long. And now I feel like Wow, so much has shifted in my
Yeah,
body in the last
absolutely.
3.5 weeks since I did this surgery. So, and now I'm going to go do another one.
Amazing. Yeah. And I
I
think
feel like it
emotionally,
will.
like as you know, a woman and somebody with PCOS, I'm always thinking, like, oh my gosh, try so hard to lose weight. My insulin resistance is still a problem, these hormone issues. But when you don't get proper sleep, your insulin resistance cranks up, your cortisol levels crank up. What happens? Your hormones dysregulate. So I would say don't be too hard on yourself. If you're like, man, I'm trying so hard to regulate these things and I feel like I can't can't get ahead, and you're
Yeah.
always trying to catch up, there's another avenue. So there's hope. I was feeling kind of helpless and kind of hopeless myself, of nobody could give me answers, like nobody. So I just got lucky enough that I work in the field and I figured it out. But there is hope. And I have so many adult clients who are like, where were you when I was a kid? But it's better late than never.
I can totally attest to that. I know. Thank you again, Sarah, so much. This was truly remarkable information. And I would love for you to tell everyone where they can find you to book a consult ASAP.
Sure. Well, thank you again so much for having me. I'm so passionate about this because, like I said, I'm a sister, I'm a woman, I have, these myofunctional disorders, and I'm so passionate about sharing it with adults who've slipped through the cracks. So you can find me on Instagram. My handle is @healthymouth_healthylife. Again, talking about your mouth is connected to your whole body, and you can't live healthily unless your mouth is healthy as well. My functional business is Reveal Myotherapy. You can find me at revealmyotherapy.com. Shoot me an email, shoot me a text, shoot me a message on Instagram, and you can schedule a 30-minute consultation. If you even think that you're like, some of this sounds like me, I don't know if I have proper oral rest posture, just do a quick 30-minute consultation with me, and you can tell me more about your story, and we can figure out how to best help you. And like I said, that's at my website, revealmyotherapy.com.
Amazing. Thank you so much.
Thank you, Nicole.
And that's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes, and let me and my guests help you to get to know your period and your body better. In the meantime, if your hormones are screaming for more, check out my latest Period Party episode. And if you're looking for an even deeper dive into your hormone and period problems, go ahead and take my period quiz at NicoleJardim.com/quiz.